Good morning and thank you for coming. Today we're addressing long-term care and the needs of Californians. I'm Jonas Rosser. I'm with the 3 and 4 Association. The 3 and 4 is a nonprofit that's based off a Health and Human Services statistic that 70% of people needing long-term care by the time they're 65 or older. It originally is what we based our campaign off of. We believe in educating. We believe that without a plan is a plan to fail. And long-term care insurance may not be appropriate for everyone, but having a long-term care plan is. As we continue to do our outreach, we also learned to find that people ages 30 to 45 are very interested in learning about long-term care. Actually, 77% of the people that we addressed were. So that's actually 3 and 4 of us for sure. So once again, education is key. This represents 3 out of 4 people that are in associations at your church, in your place of work. Without a plan, again, is a plan to fail. As we've crossed the nation performing outreach and education, we have tried to expose the impact of long-term care in the work site. We've tried to work with many government facilities and government services and whatnot to help spread the word. Today we're very pleased to have Dr. Marion Summers. She is a PhD, she is an author, and soon the star of a reality TV show. We also have Jim Grawl here as a long-term care specialist to talk to us about long-term care insurance. And we also have Brenda Bufford from the California Partnership for Long-Term Care. So I'd like to welcome Dr. Marion up here right now.
Most people don't understand that when they are needing activities of daily living, the incredible impact it has on not only them, but the rest of their family. And activities of daily living, also known as ADLs, include transferring, toileting, bathing, dressing, eating, continence, incontinence, physical or cognitive impairments, whether it's early dementia or full-blown Alzheimer's. The impact is enormous. The latest statistics, the earlier statistics were that 16% of caregivers die before the person that they're caring for, because you're not always caring for somebody who is much older than you. It may be a spouse or a sibling. The latest statistics are in the 30% of caregivers die before the person that they're caring for. And I don't throw the statistics out to scare anyone. It's just that caregivers are so busy taking care, and all of their energy is going out, that they stop going to the gym, they stop taking care of themselves, they stop going to whatever gives them strength and encouragement and nourishment, and all of that energy goes out, and they just become very depleted and very often get sick and very often do pass on. Just keep that in mind. More than 12 million people in the United States need some long-term care. The average age is 66 years old. 41% are working adults. 75% of the caregivers are women, not only in this country, but around the world. The numbers 3 and 4 came out of 3 out of 4 people over the age of 65 are going to need some form of long-term care. That's where the numbers for the 3 and 4 Association came from. They came from the statistics that are out there right now. Just a little levity. On my 65th birthday, I'm going to lie down in the crop circle and wait for aliens to abduct me. That's my retirement plan. And sometimes when I have heard other people's retirement plans and they're unrealistic, they haven't spoken to their families, they haven't really looked at their assets and what they can financially do, physically do, and emotionally do, not only for themselves, but their family members. So ask yourself, I'm not going to ask anyone to raise their hand, but ask yourself, what is your health? What is your health history? What is your family health history? What is your age now? Now is the time to investigate how to deal with long-term care issues. Now, the earlier you are, the younger you are, the earlier you start the investigative process, the educational process, the wiser you will be, not only for yourself, but for the family members that you may be responsible for. So look at your family financial situation, look at your own financial situation, and figure out what's realistic for you. And what role will your family play? I've heard people say, oh, my kids will take care of me. Well, not everybody has kids. And will your kids really want to totally disengage from their jobs, their own responsibilities, their own commitments to take care of you? And do they live at a distance? Most people don't have grandma and grandpa and parents living close by. So we're dealing with long-term care and long-distance caregiving, which just complicates the whole caregiving process. Why choose long-term care? Do you want to come up and start with this? All right.
You're on a roll.
Long-term, I will right after this slide then. Long-term care protection gives you the opportunity for control, independence, and choice. I have been in the long-term elderly business for over 45 years, and everyone wants to stay at home and be independent till the day they die. How will you have access to quality care? What are your venues for asset protection or estate preservation? Are you adverse to welfare and Medi-Cal? Most people want to maintain that independence and do not want to become a burden. But my experience has been that when people have really protected themselves to the very best of their ability, they have really purchased peace of mind. And that doesn't come with a price. That's invaluable. That's priceless. How about you coming up and taking over? You're the expert in this field. Long-term care insurance is so important.
Yes, it is.
Please explain.
So, as Dr. Marion was saying about the level of care and why choose long-term care, we can see that who's paying for those costs. We all have a long-term care plan, whether we know it or not. The result is it a personal plan or is it a public plan? Public programs constitute about 58%, a little over 58% of all of the care right now being provided through long-term care. Personal savings is second at 27%, but how many of us are going to have the ability to save the amount of money we need to pay for this care or this plan? Private long-term care insurance, which is really the best way to go, is only 8% of all coverage right now, which is a very small amount when you look at it. And then other private insurance, which is the family members taking care of you. And as Dr. Marion said, how many of your family members really want to spend time taking care of you or have the ability to? So right now, spending on long-term care services for the elderly is estimated to quadruple in the next 50 years to $379 billion. So it's kind of like a national deficit. A little levity again. How many Californians feel this way? I'm not going to go to the doctor because if I go to the doctor, they'll actually find something wrong with me and therefore then I'll have to have a problem. So I'll just avoid the doctor and stay healthy. Isn't that how we avoid long-term care facilities? So there are four kinds of people, according to former First Lady Rosalind Carter. There are the kind that need care, the kind that have given care, the kind that will need care, and those who will be caregivers. And the question really comes down to which one are you going to be long-term? Are you going to need the care? Are you going to give the care? Or have you given care? I think probably most of us in this room have known somebody that needed care of some form or another during their lifetime. So are you going to be a rich man and buy a long-term care facility? Do we have the assets to do that? Are you going to be a poor man or woman and be stuck relying on somebody else to provide your care, such as the state? Or are you going to be an insured person and make sure that your care is provided by an insurance company and a third party so that you can choose to get the quality of care that you want and not be told where you're going to go? So what is the California Partnership? In order to do that, I'm going to bring up Brenda Buford, the director of the partnership, and she is going to explain what that is for us.
Thank you.
Thank you, Brenda.
Good afternoon, everyone. Well, the California Partnership for Long-Term Care is a state-run program. We are part of the Department of Health Care Services. We were created by the legislature back in, I want to say, the 1980s. We start with our first policies back in 1994, so we've been around for quite some time. We provide free information, so you can go to our website, areyoureadyca.org, and find out lots of information and resources on how to help you plan for long-term care. Basically, our mission is to increase the number of Californians who have private long-term care insurance so then they can have a choice and remain independent when planning for their long-term care. Our policies meet stringent state requirements and guidelines. Not only are those policies reviewed by the Department of Insurance, but they are also reviewed by the Department of Healthcare Services, the California Partnership for Long-Term Care. And we also offer some special features and opportunities that other non-partnership policies do not offer. Okay, there are 4 long-term care options. You can depend on your family, and you need to ask yourself, what role do you want your family to play in your long-term care? Do you want them to actually come into your home and take care of you? Do you want them just to pay for your long-term care facility? Do you want them just to make sure they put you in a nice facility and forget about you and just leave you there? Okay, so you need to know what role you want your family to play. Have you had the conversation with your family to know, so they'll know what you want for your long-term care? There's a great article that we have on our website, areyoureadyca.org. It's called Talking to Your Parents, the Conversation. It doesn't just have to be your parent. It could be your brother, your sister, your aunt, your uncle. Have the conversation with someone and talk to them about their long-term care. Let me give you a personal example. My father passed away in 2009, in the year 2000 from pancreatic cancer. And that seems to run in the family. So my brother decided, I'm gonna go ahead and get my long-term care insurance policy now. At that time, he was 37 years old. Okay, so if you know there's a family history, some type of family history, diabetes, heart disease, something along those lines, we always say get a long-term care insurance policy while you are young and before you're diagnosed with some type of pre-existing condition. Are your plans realistic given your family resources? As the gentleman said, can you afford to pay for the facility yourself? Or are you just going to, rely on the government to pay for your long-term care? So please start planning and decide if you do want to depend on your family. Next, we have self-insure. Again, can you afford to pay for long-term care out of your pocket? Right now, I believe that the cost of care is $240 a day in a nursing facility. That calculates out to more than $87,000 a year. So can you afford that? How many of you can afford to just fork out $87,000 a year? I can't, okay? No. So I like to tell people, you can pay $4,000 a month for a facility, depending on where you're staying, or you can use that money to pay for an annual long-term care insurance policy. So the choice is yours. So also on our website, we have a self-insure calculator. So you can go in there and play around with the different figures to see if you really can afford to self-insure. Again, can you afford it? Is it the best way to use your money? I know a lot of people want to leave their assets, their financial assets, the monetary assets to their family, to the favorite niece or favorite nephew. But if you don't plan, will you really have that money left in order to do that? So determine if you can self-insure. Then we have government assistance. All the requirements are different when you have government assistance. You can't have very many assets. You can only have one home, one car, so the assets are minimal. So you need to think about what are the requirements for government assistance. For example, with Medicare, it doesn't pay for all the long-term care. It pays a part of the first 100 days, and after that, it doesn't pay anything. So that means everything else has to come out of your pocket. So if you are in a facility and you need to be there longer than 90 days, longer than 100 days, it's coming out of your pocket. Medi-Cal covers mostly nursing home. It doesn't cover assisted living unless you can get into one of those waivers programs that they offer. It doesn't cover residential care facilities. It requires that you spend down your income. And of course, there's a share of cost. So you really need to know if you would like to start off in a Medi-Cal facility, because not all the Medi-Cal facilities are right where you live. It all depends on where they have an open bed. And VA, a lot of people say, those veterans, I'll just go with the VA, but they have limitations as well. Your income has to be less than $3,000 per month. Okay, and a lot of times their benefits, their monetary benefits, are more than that, and their assets can be no more than $80,000. Okay, so that's for VAs, and then, like we said, they all have limitations. Also, disability insurance does not cover long-term care, and your health insurance does not cover long-term care. Next, we have long-term care insurance, and we know not everyone can afford long-term care insurance, but this is just one of the options that you have. So You always want to look for a plan that's comprehensive. That means it will pay for care in a facility if you'd like to go to a facility, and it will also pay for home care. It will also pay for community care. Look for a policy or a plan that has inflation protection and care coordination and care management. Those are very good things to have. And you can find out more information on our website, areyoureadyca.org. And when you look for a policy, be it a California partnership policy or non-partnership policy, always look for inflation protection, some type of inflation protection, so that it will keep pace with the cost of care that's in your area. Care coordination, as I stated before, care coordination is very important, because even if you purchase a one-year plan, that care management benefit that you will get from that one-year plan can save you tremendous headache, because a person will actually come into your home and do an assessment not only on you but your whole environment to make sure that you can stay safely in your home if that's where you choose to stay. A once-in-a-lifetime deductible or elimination period, a waiver of premium, medical asset protection that only comes with the partnership policy, and you can find out more information about that on our website. And also, anyone who purchases a California partnership policy, you have the state of California there behind you as an advocate. If you have any questions, any problems with your long-term care, you can always call the state of California and we will advocate on your behalf. Now, there are some steps that you need to take in order to start planning. First of all, you need to get educated. Go to the website, 3 and 4 Needs More. Go to our website, areyoureadyca.org. Both websites have plenty of information, good information. You need to know your options. You need to have the conversation with your family. And once you have that conversation with your family, you may want to also have a conversation with your agent, your clergy, your financial planner. Make a plan. Talk to your trusted professionals. And always, always, always talk to your family. So, get a plan with your family. I'm going to ask Dr. Marion to come on up, and then we can answer any questions that you may have.
I just want to make sure that the audience out there also knows that they can download this pamphlet, and it is very clear. It will give incredible information, and you go to the www.3and4needmore.com, and this will get downloaded as a PDF.
I'm Dr. Marion. I'm traveling up and down the coastline of California, educating people as to how they can best prepare for long-term care issues in dealing with long-term care insurance. I have a PhD in gerontology and special populations, which means anybody with a physical, mental, or emotional handicap. I have been dealing with the elderly for the last 45 years. And in essence, I've been dealing with the elderly since the age of 9 because I had no grandparents. And the building that I was in was all elderly people, and I just loved them all. Oakland is a very swinging, really a beautiful town. It's a large city, and yet it has a small town feeling. And we know that people here are hurting with their long-term care issues. All of a sudden, grandma or grandpa falls, or their parents have an issue, and they need to learn how to best take care of themselves and how to best take care of anybody that they may be responsible for. Long-term care is anybody who needs toileting, shopping, laundry, they need to be fed, they have mental issues, they need care. Some sort of activities of daily living, they're going to need some care, and that's what it's all about. How do we care for people who now need help or assistance? The earlier you get involved with your own health and well-being and understand that if you need help down the road, how to best educate yourself now so that you know what your options are. Your financial options, your emotional options, you know, who's going to take care of you and who's going to pay for that care. We have great websites here in California. California is proactive in people trying to help themselves, and they are supportive of that. The California Partnership of Long-Term Care has a great website where they have free information that can be downloaded, and also the 3 and 4 Need More. That's number 3 and the number 4, 3and4needmore.com. That also has great information plus a booklet that can be downloaded. It becomes a PDF. It comes into your computer. I love that terminology. One, to start the planning process, start the education process, and the younger you are, the healthier you are, the lower the premiums are going to be. It's a very practical approach. Also, you may be taking care of people in your family and you want to be able to help them before the need arises, because once somebody becomes sick, they may not be eligible. Go to the 2 websites. The California Partnership for Long-Term Care has a great website that's chock full of information that can be downloaded. It's all free. And the 3and4 Association.com also has information that can be downloaded. It's free, and it's the beginning of the education process. Yes, the time to start is right now while you're young and you have all your faculties and you can make these choices. I always say a failure to plan is a plan to fail. And if you don't plan and something happens and your family doesn't know how to take care of you or doesn't know what your wishes are, you've not only lost your independence, but you may have lost some of your dignity.